In this video, we will train you on the proper use of the HoverMatt Single-Patient Use Link to prone patients in the operating room. We will explain how to prepare the equipment and patient for proning, the technique for proning the patient, and how to turn the patient back onto the stretcher in a supine position. This technique is recommended for patients with a stable spine. The patient begins on a stretcher with a HoverMatt SPU link beneath their body with all side rails raised. The stretcher should be positioned close to the OR table. Lower the stretcher rail on the side of the OR table. Ensure the HoverMatt SPU link is untucked between the two surfaces. Lock the stretcher wheels. Raise the height of the stretcher 2 to 3 inches above the height of the OR table. Attach and secure the air supply by inserting the hose into one of the intake valves. Inflate the HoverMatt SPU link by initiating airflow using the appropriate HoverMatt button and slide the patient onto the edge of the stretcher closest to the OR table. Press the standby button to stop the airflow. The patient straps should not be attached while prone positioning. A minimum of 4 caregivers are needed for this patient handling task. 1 caregiver turns the patient, 2 caregivers receive the patient, and the 4th guides the head. If the patient is conscious, explain the task. Ensure that all tubes and lines, if any, are clear of patient contact, kinking or disconnecting during and after the turn. Employ the head rest pillow as per the manufacturer's recommendation prior to the turning of the patient. A pillowcase is used to tuck the patient's arm closest to the OR table. Ensure the arm is in an anatomical position with the thumb up per AORN recommendations. Tuck the HoverMatt SPU link about 4 inches under the patient on the side closest to the OR table. Confirm team members and patient are safe prior to inflation. The caregiver at the foot activates the air supply. The caregiver closest to the stretcher will apply gentle upward traction as the HoverMatt SPU link inflates. This will facilitate the turning of the patient on the edge of the stretcher. With larger patients, this caregiver may need to push to keep the momentum. As the patient is rolled onto their side, the caregiver on the receiving side positions their body against the OR table. The caregiver's hands are raised to receive the body, supporting the shoulder and hip. Caregivers should guide the patient onto the OR table. Once the patient is centered, have the foot end caregiver turn off the air supply by pressing the standby button. After surgery, bring the stretcher back alongside the OR table. Attach the HoverMatt SPU link straps to the 4 corners of the stretcher. Ensure the stretcher and OR table are locked. Raise the height of the OR table 2 to 3 inches above the height of the stretcher. In this video, we are using a pillowcase to tuck the patient's arm. Ensure the arm closest to the stretcher is in an anatomical position with the pinky up per AORN recommendations. Tuck 4 inches of the HoverMatt SPU link under the patient. Confirm team members and patient are safe for inflation. The caregiver at the foot activates the air supply. The caregiver closest to the OR table will apply gentle upward traction as the HoverMatt SPU link inflates. This will facilitate the turning of the patient onto the edge of the OR table. With larger patients, this caregiver may need to push to keep the momentum. As the patient begins to roll on their side, the caregiver on the receiving side positions their body against the stretcher. The caregiver's hands are raised to receive the body, supporting the shoulder and hip. Please refer to the HoverMatt Single-Patient Use Link product manual for detailed instructions for use.